Hi guys, welcome to Hair Talks by Terra Medical. Today we're not going to be doing a sit down whereby I talk to you about various hair topics. Today what we'll be doing is something slightly different. We'll be giving you a peek into what a day in a hair restoration surgeon's life looks like. Okay, the time now is 8:30. We're on the way to clinic, the Terra Medical at Orchard Road. What we have installed today is 1800 graft FUE surgery, where we're going to lower somebody's hairline, a lady's hairline. It's going to be a long and fruitful day for me, and I'm excited to bring you guys along for that journey. So today's surgery is basically going to be on a patient who has come in to see me for a congenitally high forehead. So she doesn't like where her hairline is at the moment and would like to lower it. And we had a consultation a couple of months ago, and I gave her a few options. Either we can style it with a different parting, but she's somebody who's always in front of the camera and she would actually like for stylistic versatility, so that's what we're going to give to her. We're going to lower her hairline with FUE grafts. FUE refers to the type of surgery that we're electing to perform today instead of a linear strip excision, and that's going to frame her face in a more harmonious manner, lowering her hairline and actually advancing the temple line slightly. And this surgery is quite commonly carried out in Terra Medical, maybe 3 times a month, for female patients who really like that cosmetic effect of hairline lowering surgery. So my ideal dream case would be to do a surgery which really restores a patient's confidence, especially in patients who've had hair loss due to, let's say, a medical misadventure or a traumatic event like a car accident or burns, and to be able to give them back that confidence of their hair and living again in their own skin. That would be my dream case.
I'm happy to do whatever you think will look the most natural afterwards.
I think the impact of surgery, if we push it a little bit further, won't frame your face as nicely.
Okay, then I'll just go with whatever you think.
We'll go natural. So what I'll do is around the front few rows, we'll place single hairs. Your hairs are very fine, so they'll appear soft when in photos and in person. The baby hairs that you see here
are super light.
Yeah, not much point in having them around. They might just be flimsy when you leave your hair forward. We're not going to place over them. They're going to be intermingled with the terminal hairs, the strong hairs that we're getting from the back of the scalp. And we're going to fill in all these empty areas around the side so that when you want to comb your hair back,
yeah, I'm very excited for that.
It's going to look like a nice new frame of your face.
Okay, I'm happy to go with whatever you think is best.
Let's do that.
Okay, cool.
So this next part of the procedure is where we're going to anesthetize the donor area, and we're going to start extracting the graft using that machine, the FUE punch by Trivellini systems. And we're going to aim to get 1800 grafts. We might need to do some long hair extractions around the side and just above that margin here. We're not going to shave those areas so that we keep the area of shaving as small as we can. Okay, now we've just completed the harvesting portion of the procedure. That was after we made the sites, so we knew exactly what numbers to get. We're just tallying up the numbers now. The team of technicians and nurses are quality checking the grafts, sorting them out into singles, doubles, triples, and higher order number grafts, so we know exactly what numbers we have for the implantation later. And what's going to happen now is we're going to go for a bit of a lunch break, and we'll see you in 1 hour. Okay, now we're back from lunch. This part of the procedure is where we re-implant the harvested grafts into those pre-made sites that you saw earlier on. That lies with the responsibility of the very experienced hair technician team here. And I'll be popping in and out of the surgery room to have a look at how the progress is going. If there's a need to re-anesthetize and get more numbness and pain control, that will be done along the way as well. But you know, we have got a happy, comfortable patient here today, and she's certainly going to let us know if there's anything that's bothering her. She's fully wide awake now, and maybe can catch up some TV on Netflix. Final few. Just want to patch up any areas that we think that need to have an increased density. Yeah.
Well, is it very gently, right?
Yeah, gently tap on them, no rubbing or circular motion.
Shall I use gloves as well?
You don't need to use gloves. Yeah.
How long do I need to put the stem cell stuff onto the top? For 1 week?
2 days.
So today and tomorrow, or tomorrow and the day after?
Yeah, these few days only you will finish the small bottle. You might feel like
We're going to summarize actually what we've done today.
Okay.
So what we've done today is actually taken an FUE harvesting off the donor area around the back and gotten actually 2,029 grafts.
Whoa.
And we've put them across your frontal hairline.
All 2,029?
All of them went in. So the density is expected to be a little bit more than 1,800 grafts as planned. But the hairline, that's the position. What you see today is the position that you're going to get when it starts growing in 4 months. That's when it really starts sprouting. In the meantime, what you need to do is really take care of those grafts, spray on them, keep them moist, follow the instructions in terms of medications and stem cell usage. And I think we'll be good. You're going to enjoy what you want to read from this.
I was very emotional inside. I'm very happy. So thank you very much.
So all clear on the overnight instructions. You have our number. Please call us if anything untoward should happen. I don't expect that. We'll see you tomorrow, 2 p.m. for your follow-up. Okay, we're going to take photos of how that's looking. We're going to wash your hair in clinic and teach you how to wash your hair after. And we're going to apply a healing laser to your scalp. Okay? So that all happens. Give us an hour of your time.
That's amazing. Thank you very much. That sounds good.
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 Alright, time check. Now it's 7:37 and you've just been through with us the entire day. It was a long and fulfilling day as promised. And we finished the surgery on time, got the patient discharged on time, and what you saw was the average day of how a hair restoration surgeon works. You saw the ins and outs of the surgery from the start to the end, and it's time to say goodbye, bid you farewell, and we'll see you again next time. Bye.